Good evening, everyone. Thank you all that you have found your way on this beautiful spring day in Zurich here to our talk that we will provide today. I'll give some quick introductory remarks because today will be a bit of a special talk. First of all, we have a patient speaker about which we are very much excited. And also, it won't really be a talk, but rather an interview. So I will give a very quick introduction to Andrea, then he will also talk a little bit about his life and his pathway that led him here. And then we will go into an interview section. So I will ask Andrea a couple of questions, and then at the end you also will get a lot of time to ask your questions. And Andrea is extremely open, so don't be too shy to ask your questions. And if you found some question that would somehow not be appropriate, I'm certain he will rebel against it, so don't be afraid of that. Okay, so very quick introduction. Andrea has studied international relations and the development studies in Trieste in Italy and also in Geneva in Switzerland. And he also works in this field right now, correct? At the Swiss Agency for Development and Cooperation. Within his work, he has traveled a lot, but also privately. He has kids and wife and lives in Lugano, so in Ticino. And he has lived a very successful life, I would say, at least. And in 2019, he got, at 36 years old, he got the diagnosis of colon cancer in stage 4, which obviously was a big shock to him and his family. After doing all the medical procedures that are required for such a diagnosis, in 2020 he also decided to be part of an LSD study for terminally ill people with Peter Gasser. I also put the studies, one there and one over there. If you are interested in reading them, you can do so after the talk. Exactly. And ever since these studies, ever since his psychedelic-assisted therapies, he has what must be described has been an advocate for psychedelic-assisted therapy. He has given several talks on the topic because of his very special insights that he has into the theme. He has been part of a documentary, which I can very much recommend if your French is good. It's called Temps Présent. Very nice documentary where he's a part of. And very recently he has been part of the Psychedelic Care initiative. That is a European citizen initiative which tries to make psychedelic-assisted therapy more accessible in the whole European Union. In Switzerland, it's already somewhat legal, but the European Union is quite some steps behind. And if you happen to be part of the European Union, so you are not Swiss and not from the UK, but I don't know, from Germany or something like that, you can scan the QR code on the left-hand side, which will lead you to a petition where you can sign. The goal is to sign, to have 1 million signatures by the end of the year. It's a big goal, but maybe we will get there. And Andrea has been there as a patient testimony in Brussels to support this progress, really. So we are very thankful that Andrea has made the time to come all the way from Lugano to Zurich to honor us with his presence. And without further ado, I will give the stage to him.
Thank you so much. Thank you so much, Nathan. It's really great to be here and to see such a big crowd in front of me. 6 years ago, when I started, this would have been unthinkable, and now I'm seeing associations everywhere, and really a civil society push to get access to psychedelic therapies. So as Nathan said, the story of mine here begins in 2019, when I was diagnosed with stage 4 colon cancer, which puts me pretty much into a existential crisis at the moment. So I underwent all the surgeries, a very aggressive chemotherapy, but within myself, I was really somehow looking for answers. I went through a whole process trying to understand the disease. I really wanted to go in depth. Started doing some meditations. And then somebody told me about LSD, not that much as a therapy, but LSD as an experience altogether. And of course, I knew LSD. I had tried quite a few substances when I was a student, but never LSD, because LSD had a terrible reputation 20 years ago at the time. LSD was, yes, there were terrible stories that were being told about taking LSD. Be careful, you will jump out of the window, and you end up in a psychiatric ward for the rest of your life. No, this was a bit too risky for me, and so I actually never tried it. I had tried psilocybin, mushrooms once, but never LSD. And so and then I said, okay, now it's time. No? Not much to lose anymore. I can take the risk now. And so I wanted to take LSD. And then my wife, who's a psychotherapist, she told me, watch out, there's University of Basel, they're doing some trials now. And so I Googled, and I found this trial, which was measuring, as Nathan said, measuring anxiety in patients with potentially fatal diseases before and after taking LSD twice. And so I got to know Peter Gasser in Solothurn and Anke Röskamp, actually his wife, and who became later my therapist in that case. And so I signed up for the studies. I filled in tons of questionnaires, and then the day came. It was just during the pandemic, actually. In May 2020, I had my first LSD trip. You have to imagine in therapy, for those who are not really familiar, it's a classic psychiatric, private psychiatric studio. Imagine it. There's a mattress on the floor, some good music equipment, and that's all. And so, and there was only, so my therapist, Anke Röskamp, at that moment, I had only met her once before, and I really had a good feeling with her. I really felt like, yes, she's a doctor. I can let myself go completely here. I had read a bit about these therapies, obviously, to prepare. And so there were 4 sessions you do. 2 were with LSD and 2 were with placebo in a double-blind study. It's particular to do it with placebo in this case, because after half an hour, both you and your therapist, yes. But you still have to spend 12 hours together. And so my first one was actually LSD, so I could really feel like everything started moving and the ceiling started moving. It's quite a high dosage, it's 200 micrograms. Immediately I felt I belonged, like my identity as Andrea was no longer there. And I started to feel, later I knew that they call it oceanic, how do they say? Boundlessness. Yeah. So this out-of-body experience, disembodiment, I left my body. I felt that I was everything around me. So my identity was no longer Andrea, but it was much more. I lived my own birth, and then so many births before that, that became a real thing for hours during the trip, until I got to the beginning of humanity, and at some point I was all of humanity, and there was a source, probably God, it has different names, but in that case, it was the source. And this source, I could feel that how everything we do is we look for contact with the source. We want to connect with the source. And I could really see some people try with alcohol, some people try with money. There's so many different ways we all try to connect to the source. But the source is always there. This was one of the teachings for me. It's always there and you can always access it. And so I had this session. I could talk about it for hours probably, because this very first session was so maybe one more point that I will mention. I also had some contact with my ancestors in that moment, which came very clear in the afternoon when I started being somehow able to communicate again. In the morning was impossible for me to communicate. I could really, you know when you see all the steps that you have to go through to communicate, I have to say, oh my God, I have to use my vocal cords, and then I have to make a sound, and then I have to say something that actually makes sense so that my therapist can understand me. It seemed like so hard in that moment and such a long process we have to go through. And so I had this contact with my ancestors and I understood, without going into detail, but it was very precious for me because I understood things that my ancestors had lived through that were forgotten or ignored in my family. And that explained very well why I am how I am, and my other members of my family are like they are. And so I had this absolutely amazing trip. I came back completely enthusiastic about LSD. And I had a second trip a few weeks later, which was different. It was very physical, and I could really feel like how my brain was working, and I felt lots of pressure around the head. Then I had the 2 placebo sessions, which were also nice. Spend some time with your therapist, but the protocol was not followed completely. We also actually went out and had lunch, but yes, you do what you can, with the rigidity of the studies, obviously. Then for a year I didn't have any sessions anymore, and then I was accepted in a group therapy with LSD. Actually, no, it's not LSD only. Actually, it's like a psychedelic assisted therapy in a group setting, about 10 or something patients at the time. Not all of them had like cancer or diseases. Some were depressed. You had all kinds of psychiatric conditions present. Sometimes it's hard to talk about my own improvements in my life since that. But I've seen in other patients over the years, it's a group that meets maybe every 3 months. And I could really see how much some severely depressed patients who could hardly move actually slowly came back into life. And it's a very interesting setting to do this in a group, because also the whole boundaries between who's the patient and who's the therapist in that moment, they start mixing. And so maybe a few words still on what it changed in my life. One of the things I could really work on during the sessions was my emotions. So my relationship with my own emotions, recognizing them, understanding them, not putting a hierarchy between the emotions I want to have and those that I don't want to have. All of them are valid, no judgment in that. I probably became less judging altogether, because every existence, everything seems valid. If it has made it up to here in this moment, it's very hard to say one is better than the other. There's no better. There's just we all get to this point. Means that those were the strategies to get here. What else? So health-wise, because this is always a question that comes, I'm doing all right. I've done some other trials with immunotherapy in Milan, and like I had really few chances to get to come out of this alive. With cancer, we measure 5 years after diagnose, and I had this last year, so it's 6 years now, and I haven't healed or anything, I'm still doing therapy all the time, something I'm always doing, but I'm really happy with the quality of life I have at the moment, with the relations I have with my family, so it's going well altogether. Nathan, should I stop here? And you ask me a few questions, because for me it's important also that to give the floor to you and to see what you're interested in, and we can talk. Shall we come and go to the front?
Yeah, perfect. All right, thanks already. That was phenomenal. So we'll take our very professional seats.
It's not too bad.
And try to do an interview here. Again, thanks for sharing what you have shared so far. Just to enable some common ground for a discussion again, could you maybe reiterate what your primary goal was when entering these studies, and also like maybe take us through your thought process? So you get diagnosed with cancer, that's obviously a big shock. And then your next thought is LSD, or?
It's a good question. Well, as I said, I wanted to understand, see, is there something I'm ignoring about my disease, did I do something wrong? Am I so used to live the life I'm living now that I'm not seeing something? And I need a bit of help in that. And probably therapy helps, but I needed something to break through, probably. That was my thought process. And then when I had my first talk with my therapist, she also told me, you should have an intention before you go into this session, and really think of it, and it's important. And also in the group, I always saw everybody was having these intentions and was really happy with their intentions. And my intentions, so I thought about it. What do I want from this first session now? What am I going to do? And I thought, so what I want is actually, what am I ignoring? Is there something I'm ignoring about myself that could help me to heal maybe, or to feel better? And so in the morning, of course, I was so far away that I remember the interaction, as I said, I was really little, and at some point my therapist came up to me and she said, what are you feeling? And I was too far away to have feelings at the moment. You're beyond feelings. But the afternoon, when we could talk again, she came up to me and said, okay, what about your intention? Did anything come about healing now? And so I was like, I hadn't even thought of it, and nothing came about the disease anyway. So I thought, let me connect to this question now. And so I connected to the question, and LSD is very strict, very confrontational. And the answer I received at the moment was, you are alive today. There is no past, no future. That's all that counts. You are alive. And that was a big teaching for me, in the sense that I was not happy at that moment with the answer. And even afterwards, I wrote a report. It took me a few sessions, probably a few months, until I got out of that. Because what cancer does, or whatever disease you're confronted with, is that it pretty much psychologically blocks you on several things. Because you think, okay, I need to get better in order to live. And so you focus your attention on healing, which is good. But at the same time, I was always like, I don't know. Like people were asking me to make plans, and I thought, I don't know if I'm going to, in 3 months, I'm going to be able to travel. Let me wait for the scan, and then I decide. And the scans were never clear. You know, it's always like, yeah, good, but it's. And so, what LSD really helped me to see is, and here we get into what we call paradox, no? Here we call it paradox. The world I access with LSD, that doesn't exist anymore. You know, two paradoxical thoughts can make perfect sense. And so I understood that I can be healthy and sick at the same time. You know, I have a disease, I am in no denial, I know it, I accept it. And I'm really healthy at the same time. There's plenty of things I can do with the health that I have. Because it's a spectrum. It's not like you're sick or you're healthy. You're somewhere in between there.
That's amazing, and that's quite strikingly like a therapeutic insight, I would say. Did that arrive in the moment, first therapy session with a bang, or was it?
No, it took a few months probably. Yeah. No, it was not a striking moment. It was more something that a slow realization over the months that followed.
Okay, and what would you say helped in getting to that realization? So what you described before in a scientific paper, that would be called, as you said, oceanic boundlessness, or a mystical experience. You felt that you were everyone and everything, you connected with your ancestors. Now that sounds beautiful, but why is it therapeutic? Why does it help? Can you say something to that?
So maybe we come back to what the scientific study was measuring at the moment, and it was my levels of fear or anxiety. And I have to say, I didn't score very high on the anxiety before so I'm not somebody who could actually. My friends would never say I am somebody who has high levels of anxiety altogether, but probably I was also very good at hiding them and not feeling that. No? It's a very masculine upbringing also that I had. You know, you're not allowed to feel certain emotions, no, like fear, like sadness. We have a tendency to put them on the side, and so I had the feeling during my very first trip that I experienced something very similar to death. In a way that you lose your identity here, you leave your body, and something tells me that death must be a very similar experience. And having had a look at what life is about, what life is made of, what death is, the different dimensions that you can access when you leave this frequency here. It does make it less scary altogether. So probably my levels of anxiety decreased with the study.
Okay, no, that makes very much sense. Would you, when you say you had these realizations, you've been to a place where you sort of experienced death, you were everyone, can you try to explain to us how you experience it? Like, do you see it? Do you feel it? Do you smell it?
Makes me think Peter Gasser, so the therapist from Solothurn, who's retired unfortunately now. He once said it, I think, it's like trying to explain an LSD experience is like trying to tell somebody how a strawberry tastes, who's never tasted, somebody who would never taste it. It's hard to explain. It's beyond our usual senses. You can see music, for example, so all the senses get confused. You can see music, you can hear colors, and
You had these experiences. You heard colors.
No, I think I didn't hear colors, but I could see music. Yes.
Okay. Wow.
Yes, it's the music you can see, and I think it's a very, very typical and classical experience. Some people, I see some people nodding in the audience.
How would you know?
Yes, it's got, you see music, you hear music, and you can see patterns that move along with the music. No? Now I forgot your question.
You basically answered it. My question was if you could describe them. But as I said before, like these things are referred to as mystical experiences, and one of the key facets of them is ineffability, which essentially means that you can't really put them into words. Okay, but still very fascinating. So I guess a lot of people here are psychotherapists or are interested in becoming psychotherapists and might be interested in working also with psychedelics. Could you say something that your therapist did that specifically helped you? Like what was, maybe also say a few words to the therapy surroundings in general, like were you all talking all the time or were you just all by yourself or yeah, if you could say something to that.
So as I said, talking was difficult. That was a whole process that I didn't do much. I think there's huge discussions in this world at the moment. What is a good therapist for psychedelic assisted therapies? And I think there's so many different schools of thought. I think it's the psychedelic assist therapy. So whatever your talents are in therapy, I would say use those talents that you have already. No? If it's or the school you go to and you learn a kind of approach to psychotherapy, I would say it goes well with all of them. It just enhances the therapeutic experience, accelerates it probably. I would say, but this is a personal preference, not intervene too much. Let it go, let the person live through it. And sometimes it's really surprising, you know? Sometimes something that is said completely unconsciously by the therapist triggers something in the patient that can completely change your trip. So I think the modesty of the therapist also, to know you are just accompanying here. The mystery of life is so much bigger and what we can access with these substances. Leave space for this mystery. It will work in mysterious kinds of ways that you cannot control completely. Not much with your head, no. Let's not intellectualize everything, which probably, that is unfortunately the world we're in, the society we're in, no. Also at the university here, no. It's, we use the head a lot, and then if you can see, probably that is, we're good at that. We lack so much more, and probably these substances will want to rebalance, but our human nature is not that much in our heads only. And I've had experiences which were very physical also. I danced a lot during the group sessions also. I could feel like my whole body vibrating, shaking something off was my feeling.
And then you were in the group, like was the whole group dancing or?
No, just me. Just me in the middle, and in the end I could motivate a few others to dance with me.
Cool. How does that compare? Like you had both. You had individual therapy and group therapy, and that's also a big discussion in the field. What's better? Obviously, group therapy is economically more attractive.
Probably viable.
But how is it for the patient, which is essentially the most important thing?
I like the group, I have to say, because I love the interaction with other patients. It makes it fun. And at the same time, for example, I could see, as I said, different psychiatric conditions at the moment. I'm just going to say one example. So there's this lady, she's so depressed. She could hardly physically move. And with LSD, I can start seeing colors, no? Also colors around the people. And I could see everybody has its colors. And this lady, there was no color. And she was suffering so much, you could see, because it's not a fun thing for everyone, LSD. It can be very challenging at the moment, during the moment. No? And the first time I saw this lady suffering so much and screaming and crying for all these hours, I thought, she'll never come back. This was her last time, probably. But every time she's there. No? It's hard and useful at the same time. And I could see her, and she was complaining. And the two therapists were with her at that moment there, and like really listening to her complaints. And I looked at her, and I was like, that's not what she needs. And I took her, and I took her to the garden and showed her flowers, and something else. I knew exactly that was not, and I could see slowly the colors came back into her.
How did she react to that?
In mysterious ways. No, she was happy. She was happy. I don't know how to explain it, but at that moment, you're so connected to your surroundings that at that moment you just know.
And maybe a patient who's on the same substance knows better than the therapist what is needed at the moment.
Yes.
Okay, but still, so you described, you heard her screaming and
there's
complaining all the time,
and a lot of screaming.
At the same time, you and others are on these substances on which you are very vulnerable. Were you at no time like negatively affected by these things?
No, I wasn't. It's interesting because you were in this kind of, I was observing her. I spent lots of time just looking at her in front of her. And I could say, oh my God, all this suffering. And I was like waiting, there must be an end to it at some point. You must get to your lowest point at some point so you can rise again. And I was actually waiting for it to happen, but it didn't.
But you were very much with her then, so you weren't focusing on your.
She was my neighbor.
Okay, I see.
Lying next to me, and I had another one screaming on the other side. No, of course. So what these substances do, whether it's MDMA, LSD, or psilocybin, they confront you in a certain way with what you are ignoring about yourself. And this can be very vast, but childhood trauma is a thing. You are often, like most patients actually, are confronted with memories from your childhood or transgenerational, so which was the case for me, things your parents or grandparents had experienced, and that maybe it was being ignored because you could not talk about it. Or our mechanisms, we don't want to go through the pain, and those of you who are psychology students know this better than me. We protect. We don't want to go through that pain anymore, and so we build like a defense mechanism that is so strong that there's no way you can access it actually. And it's a coping mechanism that we have as humans. And then what MDMA does, for example, you're feeling so well that actually the healing can take place. It's just waiting there to take place. And so these things can take place. And LSD will confront you. Say, look here. Maybe it's something that you have completely forgotten because it was traumatic. Or you have just, the stories we tell ourselves, I lived that, but it wasn't that bad. I was still able to have a good life. I don't know what. And LSD will say, yes, but look there. And so, yes, it can be extremely challenging, these experiences. You can have and you can live the suffering at the moment, and it's part of it, and it should, and it's probably very helpful in the end.
Now, this might be a weird question in case that wasn't the case for you, but I think it's still very relevant because you hear it from other studies. Some people report that they sort of feel pressured to report primarily positive results because they are told this could be a life-healing treatment for others. This study tries to investigate it, and the patients obviously know what a good result is for the study and what a bad result is. So some have reported that they sort of felt obligated to report primarily good results or sort of not report the bad ones, the bad experiences. Have you ever felt that pressure, especially during the study?
The study, no, because I was being, like, I got those questionnaires by mail, and I would mail them back anonymously.
I see,
So,
okay.
I never felt pressured for that. But I can understand that this can be the case.
Yeah, but that makes sense. So you were like at home,
Yeah.
seeing an email. There's no one there who
No, it
could
was actual
judge
mail.
you,
It
sort
was
of.
actual mail.
Yeah. Okay.
I've seen patients being disappointed after their therapy sessions, after the group therapy sessions, especially with MDMA. For some, it works perfectly, and I could see patients making extreme progress with MDMA in their lives. And for others, it's because it lasts also, it's shorter, and there's a frustration because sometimes maybe the dosage is not strong enough to actually penetrate your defense mechanisms that you have in place.
Recently, I've been very interested in Dr. Ellen Langer. Probably you haven't heard of her. She's been a researcher primarily in the 80s and 90s and did some very fascinating research on mindfulness, but also mindlessness. And she's a big advocate of the fact that we hold very much power just in our mind, and that also, like I can quote her on that, she says that a lot of pain that comes from diseases we are diagnosed with is attributable to the fact that you have been diagnosed, so that you know that you have this disease. And vice versa, she thinks that just by changing your belief systems, you can also find positive effects in your body, actually, in your physical, in your physiology, essentially. So she can also be quoted saying that she thinks basically 90% of all the efficacy of any medicine is placebo, just people thinking that it will work. How do you relate to that? Do you feel like your LSD trips have also helped you in a physiological sense? Or do you think this is rather too much of a speculation?
Like in the physical sense, you mean?
Yeah.
I think it's hard to prove.
Yeah.
It's dangerous to say that because you will think, okay, if I say that now, like cancer patients will just get high and think that they will heal with that. Probably not. Also because some of Peter Gasset told me about cancer patients who actually like made peace with death at that moment, actually saw their deceased father during the trip, and who told them at the moment, yeah, you're coming soon, and it's fine like that. You know, you actually prepare for death in a certain way. I didn't have that. Obviously, my last years have been surprising. My oncologists are surprised that I'm still around. Did LSD probably did not harm? Did it help? Maybe it helps your psyche, your mind, and the mind-body connection, we know it. Then I see, I was invited to a congress in Bari about medicinal mushrooms in September, and there was somebody who worked with in palliative care in Canada with psilocybin, and she was also like, en passant, she was saying, look, there's the patients, they seem to live longer. And then anecdotal evidence, and then you see the pioneers who are doing well, Albert Hoffman, who lived to the age of 102, and you say, yes, probably it's not harming.
Okay.
I would go as far as that.
Thanks for also giving your point of view on admittedly a polarizing issue, I would say. Okay, last question before we open it up to the audience. You are in an extremely unique position. You have been diagnosed with cancer and you've done psychedelic assisted therapy, which only maybe 1,000 people have done so far in Switzerland. What advice would you give to someone who today finds himself in the situation that you found yourself in when back in 2019?
Somebody who wants to do...
Not necessarily, just somebody diagnosed with cancer.
One of the things would definitely be, okay, there's lots of advice that we could exchange on lots of things on how to, like one good advice I received at the time was like, take one day at a time. You know, don't think too much ahead, because to the evening you can get there, you know, and it's really helpful, you know, stay in the present. But I would definitely recommend psychedelic assisted therapies. I actually recommend them to everyone. You don't have to be diagnosed with cancer. It's still hard to receive it legally because you need to show that you are drug resistant, you've tried other things and you have actually a diagnosis. But I also heard now recently from a psychiatrist from Lausanne who told me they've become more permissive also. So he has patients who don't have a long history of drug resistance who can actually access. So I would definitely advise that.
And for these psychedelic assisted therapies, like, would you say you need to go to Peter Gasser or
no,
other recommendations, advice?
Any will do. And as I said, there's so many different styles. Find your style that suits you. Meet the therapist. See, is that somebody? I'm going to put myself in an extremely vulnerable situation. Is that somebody I can trust in that moment? I think that's the question to ask, to pick your therapist.
Yeah.
Listen to your gut feeling. Is that somebody you can let go? Because letting go is one of the keys also in these trips. And there's a whole discussion about letting go that I once had with a group in Ticino, because somebody said, yeah, I tried to let go and it was so hard and I tried, and the whole trip I told myself, you have to let yourself... No, it has to be a non-movement, the letting go. It's not something that you have to do. It's something that you don't do. You don't... You're in the non-movement at the moment.
Interesting, fascinating. Andrea, thank you so much already for this part of the conversation.
Pleasure.
Please, warm round of applause.
Thank you.
And so now we have 15 minutes for you to answer your to raise your questions. As always, we will come to you with a microphone so that we can hear it on the podcast, if the microphones work.
There's a few questions.
There are several questions. I will give it to you.
Thanks a lot for coming here and taking the time for us. So you said having these experiences with these LSD trips. I'm wondering I think you have changed a lot after this, like also on a personal level. And I think you got some understanding what maybe your people around you in your private life and work life didn't have. How could you reintegrate yourself into your actual life?
Oh, it's a very good question. As you said, I probably changed a lot, but I'm still the same at the same time. Again, one of those things that seem paradoxical, how can you change without changing? But they also say you change everything so that everything remains the same. I didn't change many things in my life, but For sure, and this is hard to say. You know, the disease already, you get your priorities straight. No, you probably say, okay, why am I working so much? What is this? No, what am I actually doing? No, the important things in life, you understand them. In palliative care, a nurse once told me she worked with thousands of dying people, and nobody's ever said, I should have worked more. They always, I should have spent more time with my family, I should have done more, I should have recognized earlier what I wanted to do deep down, don't compromise, these kind of things. And all of us, all cancer patients have this, whether they do psychedelics or not.
Thank you.
Thank you.
Hello, thank you. I'm Mark Heusser. I'm working mainly with severely traumatized people. And therefore my curiosity, whether the therapy with LSD did change anything in the key symptoms of post-traumatic stress disorder, that is hyperarousal, intrusions, avoidance, and dissociation. Did you see any change that could have been affected by these therapies in those 4 areas?
Mm-hmm.
Like not sleeping or having flashbacks, that kind of, severe?
So I was probably not suffering from post-traumatic stress disorder. I have to say that. I was not diagnosed any depression either. But what I can see from anecdotal evidence that I'm being told, but also scientific evidence at the moment, is that with PTSD, MDMA seems to work really well. That single session can help people who have tried so many other things. There's a lot of, but probably I'm not the best one to answer that, but there's lots of evidence now with war veterans who...
Yeah, I mean, some of the things you mentioned could point that you did know at least some dissociative symptoms.
In myself before the session.
Yeah, like what you told about your own experience or how you have been as a person before. A sign of that changing would be that you're more aware of your own body, for example.
Yes, yes. I think that whether you are now diagnosed with PTSD or just any unpleasant experience, no, that we tend to say, I don't want to go through the pain. No, it can be the feeling of shame you have, or the feeling like any emotions that you don't want to live because that pain is so strong. Yes, I can see that. I can see that, and especially the body awareness in my case, feeling more, listening to your body. Something that was already there before, but it was very subtle. And I would like also the intuition we have, the gut feeling. I would probably not listen to it for important decisions in my life. And now I'm only listening to that. Nothing else comes in the way of me and my feeling.
Thank you.
Thank you.
Okay. My question is, as a cancer patient, you also said you had quite an aggressive chemotherapy, as well as the trial you mentioned with the immunotherapies. My question is, how does that work with? Do you set like the point? Is there any interaction because of the medications, right?
Yeah. Okay. So my liver was always tested before the sessions, and I always had like the values were weird because I was doing chemotherapy and was killing lots of cells at the moment, and so they were. At some point, they even asked, "How's my alcohol consumption?" Also to know if that may be also but it was chemotherapy, obviously in my case. LSD is interesting. We're talking about microdosing. Micrograms. So it's like 0.00001 gram of substance. So the interaction with the body is almost nothing. Those who are on antidepressants, they ask them to get off them a few weeks before, because they will numb the experience also, so to have a better experience. But otherwise, I think there's very few substances where there's interactions with. I think for lithium, for bipolar disorder, something there is not good.
Thank you.
So, hello. Thank you also from my side for sharing with us. Really amazing story. So when you enrolled into the study, what was the prognostics for the development of your disease, and how did it develop during your participation into the study? And how do you think this development influenced your experiences during the study?
So statistically, I had 14% of survival chances at the moment of my diagnosis. But stage 4 colon cancer, this is the category we're talking. So if you are diagnosed young, obviously you have better chances in a certain way. But there's no differentiated statistics. So the only data we have is this 14% if you are diagnosed with colon cancer. I had mets to the liver at the time of the diagnosis, and they came back also a few months later. Once I had surgery, they came back once again. And especially my lymph system was very much infiltrated by cancer. It is still now. I'm still not... I still didn't get rid of all of it. I don't know. As I said, I think I've already answered on how it influenced. I think the mind-body connection, I believe in it. It helps you. It probably doesn't work on the body. It just works on your mind. Maybe you feel better. If you're not depressed, you cope better with the treatments and see life, see the beauty in life, even if you are, I don't know, just physically unwell. And I think that is the key to carry on.
Thank you very much. I think what I wanted to ask also is like how the physical development influenced your thoughts, or your sights on life.
Well, the diagnosis already is almost like a trip already. The moment when you are diagnosed is like, it's a big shock, and then is when you really think, okay, let's get things straight. What do I want to do? I probably don't have many years left or many months left. I don't know. Let me put more life into the time I still have. And this is the concept of palliative care, is that, put life into the time that is left and not more time to life.
Thank you.
Thank you. This gentleman, there, lots of energy in the back. Burning question.
Thank you very much for this talk. I have one or two questions. Did you embedded psychedelics into your life after that, and like regularly, on a regular basis? And second, if it's okay to ask, yes. And the second one, did you experimented with different types of dosing, let's say from micro dosing up to heroic doses and everything in between? And what's your experience with that?
So I've done it once or twice with a macro dose privately. Once because I wanted to experience it in the nature, which was not possible in the legal setting. So I've tried it once with friends in the mountains. Beautiful experience also. I respect this substance a lot, and I need a very good setting to do it. Because I think if you do a big dose, you need to take a whole day off, switch your phone off, have a sober trip sitter who takes care of you. And so I don't have that many occasions to do it. It's, I could create it if I really wanted to, probably, but I don't feel the need, which is also interesting. My last session was in August last year, and I don't feel the need to do it again. It's not like other drugs that you take on a daily basis. I have experienced for a very short time a microdosing because I wanted to see with how it can work on pain. I was experiencing physical pain at the moment a lot. It helped a bit, it distracts you somehow. But I did that for a week or two, and then I dropped it again. Yeah, I think it's the best part of it is that it's not addictive. It's a drug that is not addictive like antidepressants or other drugs we use in psychiatry. You only need it once, and it has a lasting effect, and then you can do it again 6 months later or 3 months later. You can see them. Like all the patients that when we talk, we say, we don't need it. We think it's good from time to time to do it for mental hygiene. How you go to the dentist from time to time, every year or so. Do a session also for your brain. But it's not like I need it. That's
One more question. Did you try DMT?
No. But I've heard very interesting things about it. Smoking DMT, and I've talked to Gasser also about it. They don't find so much the therapy potential in there, because it takes you very far away. 50% of the people do it, either they see aliens or elves or something during the trip. But it's hard then to... I've tried ketamine once, for example. Has a very good potential for depression, apparently. But I also know you forget everything that you saw during the trip. Probably I was in amazing places, but I don't remember any of it. So this...
Thank you.
Thank you.
Hello? Okay. Could you speak about the timeline of insights you had? Like, did you have some aha experiences, or was it a very gradual expansion, this transition you went through? And also, if you could speak a bit about the experience of the substance and the intervention of the therapist.
Mm-hmm. So, my very first trip that I briefly described, it was an absolute aha moment, as you say. So it was brutal. It was fast, and I had the feeling I had seen everything and understood everything at that moment. And some of it I could take with me. Some of the teachings from that first really stay with me, and others I did not understand them at all. Some visions I had at the moment, I thought, like, what was that about? So I wrote it down, and years later, it suddenly starts making sense. So there's an immediate effect in a certain way, and there's one that is more lasting. These substances work on neuroplasticity, and so you feel like you are somehow more flexible in the brain, and that this, Nathan, help me, how do you call it, the default mode that we're in, telling ourselves stories, and that is suppressed, and so more things become possible again, and you live experiences, whatever you're experiencing at that moment, you feel like it's the first time you're listening to music, for example. I thought, oh my God, I never really listened to music, and this is the first time I'm listening to music and it's so beautiful. Or once there was a really hot day, actually last time in August, it was really like there was a heat wave. And during the session, I went to the garden and some rain, it started raining for the first time in weeks. And I could feel the rain on my face, like it was the first time I was experiencing that. So it does something with your brain where you are open again to new experiences. That everything you do, oh my God, I'm meeting someone, oh, get away from the default mode that keeps us somehow in the society, in the rules. Yes, you break out in a certain way. And now I forgot your second question.
The second question was, from your perspective and experience, the interaction of the therapist and the journey that you were on.
During the journey, you mean?
During the journey.
Mm-hmm. So,
during the whole therapy.
yes, so it's very discreet. My therapist was very good in feeling, very experienced. Whatever the therapist says. So a question, if I ask you, how are you doing? It's the wrong question to ask. Because otherwise the patient would think, why is she asking me that? Am I not looking okay? I don't know. This whole paranoia thing that happens, because what is happening? You suppress completely the judgment during the session. So if I'm, I cannot see, are you young, are you old in that moment? All these categories, we put everything we see, all the world that surrounds us, we always say, okay, I see somebody, oh good looking, oh old, oh I don't know what. You don't have that anymore. And so you need somebody who does that job for you. And I think the art is really to feel, also listen to you as a therapist at the moment, listen to yourself, what is coming? What is coming in that moment? What is the space we have between patient and therapist? And maybe it's really to let this patient just go through everything himself. I recently assisted the psychiatric hospital in Mendrisio. They have started to work for eating disorders, drug-resistant patients, and I went there to help with the session. And one lady was there, and she was looking fine. And you let her there. Then there's the whole thing about touching. It's a very touchy subject also, because you have to ask for consensus to touch your patient and everything. But as I mentioned to you, Bill Richards is one of the pioneers who works with this. He said, you cannot ask for permission because you don't know who this person is going to be. It can be a newborn, and the newborn in that moment, you regress to being a newborn and you're crying. I'm not going to ask a newborn for permission to take him in my arms. Or you can have a rebellious teenager at the moment and who doesn't want to be touched at all. It's hard to say, but touch is something that is being used in many of these sessions also, to accompany this person, the patient. But it's very debatable.
Let's take one last question from your friend, and then we'll head out to the apero.
Thank you, Andrea, my friend. I have a question on a hypothetical mind.
Oh my God, this is going to be the hardest question, I feel.
Okay, maybe let's not know.
I have a question on the mind that wants to interpret. You just mentioned a few visions you see, and then only a few years later they make sense. And I'm sure that in the meantime your mind would try to interpret it immediately. How do you go about that, especially if it's like strong visions, strong pictures, strong messages that you want to know the meaning of?
I think putting it in words, writing, drawing, everything that is creative in that moment helps. Because you get away from the thinking and you see what can emerge. I would really suggest in that case, if you have something that is bothering you after a trip because you don't understand it in your head, then try to do something else with it. Dance it, play it, draw it, write it. I think that would help.
Okay, Andrea, thank you so much. This was incredibly insightful. As a token of gratitude, we also have a little gift for you. And
thanks so much.
Please, another big round of applause. Obviously, you have all been very interested. I think it's the first time that nobody left during the Q&A session. You also get a chance to ask questions at the apéro. I think you will be here until, yeah. And let's connect together. Just a quick disclaimer for our next talks. It will already be in a week by Professor Dr. Gregor Hassler, who's a leading scientist in Fribourg and also in Bern. That will be, again, more of a scientific talk. We'll also hear about the neurochemistry of DMT by Clemens Ecker, if you are more interested in the neurobiological effects of psychedelics. And we'll have a talk about psychiatry and psychedelics. And then also, very importantly, we also talked about it today, about the bad effects, about the ugly effects of psychedelics that they can have, the adverse effects. It will be a great talk by a brilliant speaker, Abigail Calder. I heavily encourage you to join us there. And then we'll close out the semester with another talk on psilocybin and depression. Thank you very much for your attendance, for your attention. And yeah, let's connect at the apéro.